I think replacing somebody's arthritic hip is one of the greatest operations that we can do. Typically, people are extremely satisfied with the results. The groin and thigh pain that they've been dealing with for years is typically gone within a few weeks. Typical hip replacement involves replacing the ball and socket of the hip joint. So my approach is an anterior approach, and that involves going in through the front of the hip, an incision over the front of your hip. We go in and we remove the ball of the ball and socket joint, and we prepare the cup or the acetabulum within the pelvis to accept this acetabular component. This is impacted into position. It's what's called press fit, so we don't use any cement during this surgery. And then a plastic liner gets snapped up into this piece. At that point, we then go to the top part of your femur or your thigh bone, and we prepare it to accept this femoral stem. And again, very similar, it's a press fit component, so we actually wedge it into position, and you can see the stem has a little ball to recreate the ball and socket joint. So instead of bone on bone with arthritis, what you end up with is metal or ceramic sometimes on a plastic piece. So after a hip replacement, most patients spend about an hour in the postoperative care unit. After that, they're transferred up to our joint center, and the majority of patients are weight bearing as tolerated, so we really get you up and moving right away, in most cases the same day as surgery. We control your pain with some pain medications, and if you're getting up, you're ambulating safely, you're tolerating your diet, and your pain's controlled, we like to get you home the first day. The majority of patients these days are able to go directly home. There's not many that need to go to any type of rehab facility. There's not much physical therapy involved after a hip replacement. Typically the therapy is just getting up and walking around as much as possible. I see you in the office about 2 weeks after surgery. At that point, we get your staples out, make sure everything's healing up nicely, get an x-ray to make sure everything looks good. The first couple weeks can be painful for some people. We try to control it as best we can. After that, the pain really improves on a daily basis. Most of the time when I see people around 6 weeks, they're really happy they did the procedure. And typically by about 3 months, you're sort of normal back to your regular everyday life. I do like to warn people that you continue to improve up to a year after your surgery. It's not uncommon for people to have disease in both hips. I typically like to only do one at a time. I think it's a lot safer. It's been shown to have a lot less complications and risks associated with doing 2 surgeries at the same time. If you need bilateral hip replacements on both sides, typically I like to space them out at least 2 or 3 months apart to let you really recover nicely and give you a good leg to stand on for your second surgery. I recently completed a hip replacement on one of my patients. Just saw her for her 6-week follow-up, and she called me her hero. Previously, she'd been unable to play with her grandkids on the ground and had very much difficulty with hip and groin pain. After replacing her hips and only 6 weeks of recovery, she was back to doing these things and was very grateful for it.